Hey, I'm Boone Christensen, and this is 5 Minutes of Therapy. Today, we are going to talk about what actually makes therapy effective. There are a lot of misconceptions about what people are looking for in therapy and in therapists, and we're going to take a look at what the research actually says about this. So, to start, first question, does somebody's degree actually contribute to their therapy outcomes? So let's look at the different kinds of degrees that we have here. We've got MDs, medical doctors, those are psychiatrists. Our PsyDs and PhDs, those are clinical psychologists. They go to school for at least 5 years to get that kind of degree. There are licensed marriage and family therapists, that is my degree, to which I am partial towards. LCSWs are social workers. LCMHCs, licensed clinical mental health counselors. LPCs, licensed professional counselors, as well as life coaches and pastors. So, which of those degrees gives you the best results? And the answer is, there's no correlation between kind of degree and how effective your therapist is. I would argue that the most influential, or two of the most influential mental health professionals today are Tony Robbins, who has no college degree. He is a life coach, as well as Gary Chapman, who writes the 5 Love Languages books. He is a pastor. So, the degree has no correlation. Though, of course, in my own clinical experience, I have some biases toward family therapists. What about amount of experience, years of experience? Let's take a look at outcomes of therapists over time. So, what the research says is that a therapist will improve an outcome like therapy effectiveness for a little bit during grad school while they're getting their feet wet, but then their effectiveness on average actually steadily declines. And that is thought to be due to people, like one, experiencing burnout and getting tired of their job, listening to people's problems all day, or the fact that they get entrenched in their ways. They get harder to relate to as they get older and doing the same thing over and over again. And of course, this isn't a rule, this is just averages. Not every therapist declines in effectiveness over time. And we'll talk about some of the factors that can prevent that, actually. But again, how long your therapist has been working is not a good indicator of whether or not they will help you. Okay, the kind of model. So we've got all these different models. We've got cognitive behavioral therapy, CBT, emotion-focused therapy, dialectical behavioral therapy, probably the most popular today in residential treatment centers, ACT, acceptance and commitment therapy, solutions-focused, narrative. There's so many empirically validated models. And what does the research say is the best one? The answer is none of them are the best. Not even EMDR, which many people think is the silver bullet, doesn't actually have better outcomes when compared to other models, on average, that is. What is important is that the model is actually empirically validated, that the research shows that it works. But honestly, any empirically validated model, or taking models into account, only accounts for 1% of therapeutic change, the variability, that is. So we're not actually looking at models in particular when we're looking for effectiveness. So what does actually work? We're looking at a couple factors. These are called the common factors, things that make therapy work regardless of degree, years of experience, and kind of model that you use. Number one is the alliance. Do you actually like your therapist? Do you relate to them? Do you trust them? This is the strongest factor, and we'll talk about what plays into that. One being collaboration. Like, is your therapist presenting a model that you actually understand and that you can get on board with? Are you guys on the same page? Do you trust the process? If you don't trust the process, you're less likely to get benefits out of it. And is your therapist seeking feedback? Is there a dialogue about the therapy process? So that we're troubleshooting where things aren't working, where there are disagreements. And all of that plays into your therapist's overall interpersonal skills. Are you connecting with this therapist? Do they know when to listen when it's appropriate, validate when it's appropriate, challenge you, give you space? Are they able to read the room effectively? Are they able to manage their own anxieties, their own triggers, anger, biases? If not, then it doesn't matter how much education or experience they have, they're not going to be as effective as somebody who is introspective and able to look at their own insecurities, read the room, and communicate with you on your terms. So, those are the common factors, what to look for in effective therapy. And again, that is from the Common Factors research from Dr. Scott Miller, and you can look it up. Thanks so much.